And before and so there's a slide like this also at the end of your PowerPoint. And so let me tell you exactly what's going to happen on your exam. On your exam, I'm going to be asking you perfect examples of each of these 9 germicidal categories. So right now I'll present you with perfect examples of each of these. So then you might have to think about that multiple choice as being which of the following is a halogen, or, hibiclens falls into which following category. So one more thing I want to talk to you about is the word lumen. Did I discuss it with you yet? L-U-M-E-N. Have I used that word yet?
No, but we used it in anatomy.
So what does it mean?
It's like a groove in something.
No, I know what you're saying. Wait, for flashlights, they use lumens for LED lights instead of candle power. But I'm going to use the word differently. Go ahead.
Yeah, there's a lumen in the bone, right?
Well,
in the bone
anything
structure
that has an inside to it.
Yeah.
And especially structures that are tubular shaped.
Mm-hmm.
So name tubular shaped structures in your body that have a lumen.
Tibia.
Sorry? Blood vessels. All blood vessels have a lumen. What
Any
else?
bones? Tibia.
Sure.
fibula.
The long bones have bone marrow and they have a lumen, but we wouldn't use that term as often as we would with vessels.
Okay.
What else?
Renal and kidneys.
You bet. So the ureter, right? The urethra. We wouldn't say the kidneys have a lumen. We wouldn't say the bladder has a lumen. Instead, we'd say that the bladder has a cavity, an internal cavity, that the kidneys have a cavity. But we're talking about tubular structures with a lumen. What else? How about the trachea, right? The left and right main stem bronchus, right? Bronchioles have a lumen. And how about the gastrointestinal tract? Small and large intestine have a lumen. So now that we've discussed that word, let's discuss that word in terms of hospital supplies that have a lumen. Can you tell me what those are?
IV.
IV tubing. Does everybody in the room agree that IV tubing, the interior of that tubing has to be sterile? Because when we put that IV catheter into you and hook up the IV tubing and the normal saline or D5 runs in, the internal surfaces of that IV tubing, that's going to come in contact with your veins and arteries if it's an arterial line, or